Osteoarthritis is a very common degenerative joint disease that affects more than 32 million U.S. adults. It is a leading cause of disability and chronic pain in our country. Traditional treatment is typically limited to physical therapy and medication, but doctors have started to use an unexpected treatment, low-dose radiation therapy. To tell us more about it, we invited Dr. Venita Williams with Providence St. Joseph Hospital in Orange County on. Doctor, thank you so much for being with us, for stopping by.
Thank you so much for having me.
Yeah, so let's start with the basics of what is osteoarthritis and who's most prone to get it.
Osteoarthritis is basically wear and tear arthritis. It typically affects joints that are used a lot, such as knees and hands, and it typically affects older adults.
And you were telling me you typically treat cancer,
Exactly.
but this is a new application of radiation, which is a cancer treatment. So what is low-dose radiation therapy, and how is this different from the radiation used to treat cancer, or is it the same?
Well, it's very similar. It's prescribed by a radiation oncologist like me. We use the exact same machines that are used to deliver precise cancer therapy, so those linear accelerators, but we use it at a much lower dose, which helps to decrease pain related to inflammation at the much lower dose. So essentially much fewer side effects than with cancer treatments.
Is it safe to use radiation for this non-cancer condition, and would it do anything to increase the risk of, I don't know, getting cancer?
Right, that's a very good question, and something that we are all very concerned about when we first started using radiation for this indication. But we found that at this very low dose, the risk of side effects in the short term are very, very low. It's kind of like getting an x-ray, that most patients don't feel any pain. There's potentially a sunburn reaction on the skin occasionally. And so the risk of short-term side effects are very, very low. However, long-term side effects could be an issue. We have looked at studies, thousands of patients treated, especially in Germany, and they found that the risk is about 0.01% up to 0.1% increased risk of another cancer happening from this treatment. So it's very low, particularly in older adults, and especially for treating areas that aren't nearby any organs that are sensitive to radiation.
Okay, so those are any potential risks, but what about the rewards? What does research show about how well it works, and is it FDA approved for this use?
Yes, so in the recent American Society of Radiation Oncology meeting, there were over 80 presentations talking about the effectiveness of radiation for benign conditions, not just cancer conditions. And there was a randomized trial that showed patients who were randomized to either 3-gray radiation, which is the usual dose for arthritis, versus 0-gray radiation. So they gave patients fake radiation treatment. And when they randomized the patients and they compared at 4 months, there was a statistically significant improvement in pain for 70% of patients versus less than 40% of patients who received the sham radiation. So there was a statistically significant improvement for mild to moderate osteoarthritis.
Wow, and it's FDA approved for this use as
Yes,
well?
The machine, especially the Varian TrueBeam linear accelerator that we use in our department, last month FDA cleared it for this indication.
Okay, and what does treatment involve if you are using it for osteoarthritis? How many sessions do you need, and is it covered by insurance and specifically Medicare?
Yes, Medicare does cover this insurance, and most private payers do as well, but we always get a prior authorization before we treat a patient just to make sure that it's covered. It involves meeting with a radiation oncologist for a consultation to make sure that you are a good candidate for this treatment. And then there is a mapping session or a setup session, which takes about 45 minutes. And then about a week later, you will have 6 treatments over 2 to 3 weeks. Each treatment takes about 15 minutes, and there's no pain from the radiation. It's just a little, you know, inconvenient to come for all those treatments, but that's the main side effect.
Wow, and maybe we don't know yet, but how long do the benefits last? Do you have to go in for follow-ups over, you know, months, years, or does it last forever?
Unfortunately, it's not a cure for arthritis. It's kind of, I think of it kind of like a steroid shot in that you can use it and it helps control pain for several months, but it's more important to do the physical therapy, to do the exercises, to do the weight loss that's important to keep your arthritis under control. So it's just another tool in the toolbox for treating a very complex problem of arthritis.
Yeah, thank you so much for coming on. I think a lot of people will be really interested to hear about that. We appreciate it. For more information, you can always log on to providence.org. And Kai, I'm going to send it over to you to take a look outside. I was out there a little earlier. It is really nice today.
Yeah.